Hello, everyone. This is Dr. Whistleblower's channel, and I'm Dr. John Tallinger, specialist of general practice. Welcome. Today, I have a special guest with me, Latifa Löwenberg. Do you want to introduce yourself to the audience?
Yes, my name is Latifa Löwenberg, and I'm a registered nurse in Sweden.
Yeah. Where do you work?
I work in Gävle and Stockholm.
Okay, so please, you have a lot to tell us about the conditions you've seen. You're in a privately owned facility for elderly.
Yes, I am in Gävle. Yes.
Yeah.
Yes, I'm working with older people, and right now we have COVID-19, and we have some crazy rules about how we should treat them and not treat them.
Can you tell me a little bit about those rules?
The rules are they are not going to the hospital. No intensive care for older, over 65. I guess we have people, over 65. And we're going to treat them at their place with morphine and midazolam. No oxygen is provided for them. So we are basically putting them down. That's what I would call it.
Yeah. It's not humane because
no, it's not humane. No, it's not.
So we've talked before. I was thinking maybe we can do an in-depth interview talking about your general reflections on the situation. Like you have a chance to tell everyone, to tell the world whatever you want, basically, because the floor is yours.
I don't know what people want.
What are you feeling right now in regards to your emotional state and the state of the emotions of the people that work with you? Can you tell me a little bit about that?
It's frustrating, very frustrating, and it's depressing to see this, because it's a lot of pain and a lot of hurt for the patients, of course, because they are basically suffering. I don't know the word. Kvävas. I forgot what. They suffocate to death.
Can you tell me, like, bring a case, a specific case to mind, and tell me? You don't tell her name or his name, but tell me, like, focusing on one specific case and tell me, like, the.
I get a call from the staff that they need the nurse, and I come there and I provide morphine and midazolam for the patients to basically keep them calm and not in pain.
Can you tell me their expressions on their faces, the old people that you've seen?
It's panic. I would say it's a panic expression. And often is it panic among the staff too, because they find it very uncomfortable to see this. And of course, this is uncomfortable for me too, but it's my job. I have to do it. There is no doctors who come out and you can call them. Of course, you can call them and get help on the phone, but you're basically alone. But now, yes, in this case, I was there for, I guess, 6 hours, 5-6 hours. I stayed with this patient, and that's not okay. They don't want me to do that. They just want me to go there, give injections, and then leave. Yes.
You want to stay and provide comfort, of course.
Yes, of course, because the symptoms are so severe. You cannot leave them all alone. That's.
What would happen if I had my wife there and she was 80 and I was 80? Could I come and visit my wife on her deathbed?
Probably not, but sometimes they make some exceptions when they're dying, if the relatives want to come, wife or children, but often they are alone.
And they're not given any oxygen, of course, for their.
It's never oxygen. It's never oxygen.
What would happen if you would call your doctor and say, we have a relatively young patient, relatively healthy, that could live for 5 or 10 years if he survived COVID-19? Because there are such cases, I presume, who could actually live.
Of course.
Yeah.
I don't know what the doctor will say, but our restrictions are not to send anyone in with these COVID symptoms to the hospital. So
you more or less have you perceived that as an order, not to bother the doctor? Can you tell me a little bit about that?
I can always call the doctor, but the doctor will not send them in.
He wouldn't?
No, I don't think so. I've never heard of it. Never heard of it. It's not in my town anyway.
Not in your town. So how many people would you say that you know that are experiencing exactly the frustration that you have and the conditions that you have?
I guess everyone who's working in Gävle feel that way, and every city in Sweden, I guess. I don't know.
Could you do you have a sense of how many patients are in places in homes where they would not get oxygen if they got dyspnea from COVID-19? How many patients would it be that you know, as a fact, would be in that position not to get oxygen? Just
around 15, 20 maybe.
Homes?
No, patients.
Yeah, but how many
who have died?
Who have died?
Yes.
How many homes are there that you know about in Gävleborg?
I don't know how many. 15 maybe. 10, 15.
15.
Yeah.
How many would be typically in one home?
Oh, it's everything from 40 to 120. So it's a lot of people. It's a lot of patients.
A low count would be 50 so it would be a very low count would be 5,000, and a more reasonable count would be 10,000.
I guess. And with home care, I say 5,000.
5,000. Okay. Yeah, so 5,000 in your region would not get oxygen if they got COVID-19 symptoms, and it's about 20% that need oxygen. So that would make it like 100 patients that's going to die if you approximate it.
Yes.
And 10 that you know of have died.
Yes.
So in your region, there's at least 90 patients that are up for death without oxygen. Would that be a fair estimation?
Yeah, I think so. Yes. I don't have the exact numbers right now, but
I'm guessing too, because it's very hard to get fair
numbers. Yes, that's very hard. But yes, it's regardless if it's 1,500, it's a lot of suffering anyway. So
yeah. I'm just trying to give some sense to the scale of it. We're not a big country like the audience is United States here, but yeah. How are you doing emotionally with stress?
With stress, over this situation, but sometimes it's very hard. It's heartbreaking. I mean, I feel like I'm gonna give up sometimes, and I don't know. It's horrible sometimes. Yes.
So you feel that you would need comfort. I mean, you would need some sort of help in the aftermath of this situation.
Yeah, I guess so. I mean, I am support for the staff. They call me day and night and want answers, and I don't know, want some leadership, because I feel the leadership is out. It's not there.
What do you tell them? How do you deal with that?
I try to talk to them and say, what can I say? I can't say much. I listen to them most of the time. But of course, they're going to call in sick and not come back sometimes because of this issue.
Yeah, and you feel like me that it's probably like we have this document out that is you got it by mail, right? You told me.
Yes, I got it by mail. Yes. The
orders not to send to hospital and effectively making COVID-19 a disease you don't treat except with morphine that kills them, and there's no treatment with oxygen. And you got this on mail, the orders, not to send them, not to give them a chance to live. You got it on mail, right?
Yes, mail, and the internet for the company to we have some e-education to learn how to make them come in some unconscious state and die that way with morphine and midazolam.
You have education for how to effectively kill your patients instead of sending them to the hospital for oxygen.
Yeah, it didn't say kill, but it said to basically put them to sleep forever. Yes,
yeah,
that's
forever.
Right. Yeah.
Okay, this is a lot to take in for, I think, the both of us. We're not used to this in this country. This what do you think happened? I mean, I know that you're engaged in politics. That you've taken up politics to change the situation of this country.
Yes, I try. At least I try, but it's very hard. It's sometimes it feels like it is impossible to get something out there.
Get something done about the situation.
Yes.
Yeah. Yes. How long have you been frustrated with what we're talking about now, with the silence culture, where everything goes as long as you keep silence?
It's been a long time. I don't know, many years.
When would you say that you became aware of the silence, the deadening silence? Like now, I'm a doctor, and I have like, I'm going to tell you my story, because I had an IC that intensivvård IC doctor that told me that basically he called me up and told me that you are so right on this. He was encouraging me to fight for oxygen because it was 100% right. He, as an IC doctor, was supporting me 100%. And he is now refusing to go public, saying that oxygen is the correct treatment for COVID-19 because he is afraid to never work again in Sweden if he says oxygen is good when you have no oxygen in the blood. So that's one doctor, the one who supported me. So the silence here is deadening. Yeah. There are doctors writing open letters, but none of them are saying people. There was one who said people are suffocating to death, but she withdrew her statement after pressure was put on her. She did that on public television. So she withdrew that dramatic. And I have a lot of contacts with a lot of doctors that are in groups that are secret. It's like they have their anonymity because it's not open for everyone, and they say exactly what I say. But yeah, I don't know if anyone's as vocal as I am. I don't know if you've heard of anyone who's as vocal, shouting out for the basic human right of getting oxygen instead of morphine when you're suffocating to death.
No, I haven't heard of it, and I don't think so. No. But
how long would you need to educate your staff to give oxygen?
I don't know. I have done that before. It takes sometimes more or less 1 hour. I talk about it. Maybe we go through the machine and things like that. So I would say maximum 1 hour.
And there was the boy, on the radio, there was a chief medical officer who said that it's too dangerous to have oxygen in the homes.
Yeah, I heard that. I did see that. Yes,
is that a fair statement to say that oxygen is dangerous, explosion risk?
No, you have to inform about it. Then it's not dangerous.
It's like don't smoke, and then the information.
Don't smoke. No, you shouldn't smoke when you have oxygen. It could go very bad. You shouldn't do that.
Okay. Yeah. Is there anything else you want to add here? Because this is a follow-up in depth, a little more about the emotional state and everything of it, the big picture, maybe even the politics, if you want to fill in.
No, the only thing I think is very crazy is that the staff cannot handle oxygen, but they can handle giving injection with morphine and midazolam, who's basically gonna kill the patient, and they don't have the education for it. They don't have the experience for it, and they sure don't have the salary for it to treat these patients by themselves. Of course, they have us nurses on the phone, but you have to see the patient to be able to tell if they're gonna have it or not. And mostly they find it very uncomfortable, the staff, to do it, so they want me to come. And I get a lot of shit for that. That's what happens. But
so to sum up, they have an education in killing people with morphine, but they don't have an education saving the people's lives with oxygen. Is that a fair?
Yeah, I would say that's the case. At least in Gävleborg, where I work.
And your perception and conviction is that this is the case in all of Sweden, everywhere.
I don't know if anyone in Sweden get oxygen in nursing homes, but I don't have a clue. But in Gävleborg, they don't.
We're gonna have to wrap it up. This is it's been really nice talking to you, actually, in this horrible situation. Still, some comfort to talk to another human being about the horrific sceneries we are about to witness. So I thank you very much, Latifa, for doing this video with Dr. Whistleblower.
Yes, thank you for having me.